All right, good evening, everybody. Anissa's playing a rabbit this year for Halloween, as I'm giving her bunny ears. She didn't know that. Welcome to the Wednesday Wellness Minutes. I'm Dr. Schilling, of course. This is our lovely assistant, Anissa. She's our director of participant ecstatic faction, if you haven't met her before. We're going to work her up this evening because she's dealing with a little bit of tension in her neck, shall we say. And the title of this Wednesday Wellness Minutes is, Do You Have Issues in Your Tissues? And of course, as you've heard me say before, no, I'm not going to say it. I'm not going to say it. Yes, while no one thing causes any one thing, if you haven't been traumatized on the outside of your body and you have pain on the outside of your body, it's coming from the inside. So just keep that in mind. Let's see, a couple announcements. I am gone next week from Monday through Wednesday. I'll be back Thursday and Friday to work with our participants. So the next week's already booked up, so definitely get your appointments in for the rest of November because I'll only be in the clinic 3 days a week for all the remaining 3.5, whatever they are, weeks. So it's already booking out. So if you need something in November, plan ahead. Tomorrow is I almost said Thanksgiving. Tomorrow is Halloween, and all of our kiddos are going to be out trick-or-treating, which is a panacea of quasi-crack cocaine with all the kids getting hopped up on sugar, which is only going to trash their guts and make their brains inflamed and mess up their sleep and their moods. And, you know, it's like lions and tigers and bear, oh my. We, in our home, my wife, in her infinite intelligence, has devised a system for the Halloween fairy. And my daughter Sophia might be overhearing this. So the Halloween fairy is one that comes in the night and swaps all the candy out for books and or little things that they can play with to learn from and things like that. So that's something we're implementing in our home, and it may be of use for you because Lord knows when they get that. Well, I used a pillowcase when I was a kid. Now the kids have buckets. Apparently we were cheap. I don't know. I don't know what you guys use, but I carry around a pillowcase. I'm like, trick or treat, you know, a pillowcase. I'm like, it's crazy. Things get full though. And needless to say, I didn't need any sugar as a child, and you probably can tell as I don't need any sugar as an adult. But try to find some way of swapping out the things for your kids and help them have a different opportunity rather than just eating sugary candy. And, you know, back in the day, they used to give out apples and stuff like that until somebody put some needles in there and it's horrible stories. It's like the Nightmare on Elm Street comes to reality, and then you have basically tricks like that, not treats. So just use that as a kind of a guidepost and help your family adapt new shall we say, traditions. Yeah.
There are some places that do candy take-backs too. Lots
yeah,
of
for sure. Yeah, there you go.
And send them to troops. So
yep, you know, Dr. Engelbrecht next door at Engelbrecht Family Dentistry, he'll probably take back your candy and give you a toothbrush or some floss and things like that. So keep that in mind and just, you know, set a new tone. You guys are the trailblazers as far as leaders in your community. If you're part of our community, then you are people and families that are thinking ahead. And if the herd's going that way and eating all the candy and drinking all the soda and all the junk, you guys are headed this way with us. Because that is where disease and illness lie and pain and suffering and misery. We're going over here to vitality. Okay, so just be leaders in your community when you're out there trick-or-treating. Okay, great. So all that aside, we'll get back to Anissa here. As you can see, she's having a little trouble turning her neck. She woke up, was it this morning or no, yesterday morning? Yesterday morning. And we've done one QNRT reset on it, did a little bit of muscle work yesterday. Things are feeling better, but there's still some lingering issues in the tissues, right? So first of all, we want to always talk about why, right? You know, well, I woke up with it. It must be my pillow, right? Not the my pillow you buy.
It's not funny.
Yeah, exactly. So what we'll do is I'm going to raise her up here. So we have a table that goes up. Exciting, right? It's like a ride at Valley Fair, not really. And so when we think about the neck, think about from a neuroemotional standpoint, criticism, stubbornness, and inability to understand. I'll say that slower. Criticism, stubbornness, and inability to understand. We can look at the gallbladder meridians that come up through the neck, right? And that can be frustration, anger, resentment, or disappointments. So all good kind of, you know, heartwarming, fun-loving feelings. If we have a conflict on the right side of the body, we think of masculine conflicts, right, left side of the body, feminine conflicts. So when in doubt, you'll know typically it's either male or female. We all have friends and family in our lives, and it just depends on who's tripping what trigger and why and how and what kind of stress we've had in the past that's being triggered now, and just depends on what it is. So which side of the body do you predominantly have your stress on? Left side. Okay. So as a clinician, I would first look at, you know, range of motion and things like that. So just turning your head to the right. So super good range of motion. Like she's like, if you've ever seen The Exorcist, it's going all the way around. No, not that far, but full 90-degree turn. Very few people have that ability. Now, if she turns to the left, She gets to about 45, and you can see her kind of straining, and that's probably not fun, so you can turn back to the middle. And is it, let's just start with yesterday. Was it sharp, stabby, burny, achy? Did it just feel like a lot of pressure? What did it feel like?
Kind of throbbing.
Throbbing,
Come
okay.
and go.
Okay. Was it specifically in the neck, or did it go down in the shoulder, into the back?
Starts in the neck and radiate down.
Okay, so it'll travel down sort of between the shoulder blades.
Mm-hmm.
How tender are these points? Down here.
Somewhat tender.
Okay, and up in here?
Or
Okay.
not as much.
All right, if we go up into the neck,
It's more medial,
this way or this way?
inward.
To the spine?
Yeah.
Okay, so
Yep, yep,
back there?
yep.
Okay, now there are a lot of lymph nodes on the neck. This is called your SCM, this big meaty thing here. There are pre-cervical and post-cervical. And so you want to appreciate that if you have any lymphatic drainage issues that are coming from the liver, they can back up. People get a lot of wry neck, like they can't turn their neck. It's because the muscles are so inflamed because of the lymph nodes around them, and then what happens is the muscles start splinting, because if the liver can't accept any more bile, right, these muscles, it's just like a bunch of pressure builds up around them, and then that irritation can cause the muscles. And so you could be humming along, all of a sudden, I just turned my head, and all of a sudden I can't, now I'm doing one of these, right? Hey, what's going on? Okay, did that multiple times in college. I'm not playing football, but Lord knows what I was eating and drinking in college. So at any rate, in this case, we might see if we can find some way to identify a root cause. Okay, so she has denied any injuries. She didn't, slip out. She didn't roll out of bed and hit the ground or anything like that, right?
not.
Correct? Hope not. Fair enough. So we could stimulate the lung points here, and then turn your head this way. Any improvement?
Not a lot.
Okay. And so we can go down to the kidney points. If I stimulate those, any improvement?
A little bit.
Okay, so a little bit there. That's improved. Spleen point is right under here. Anything here? Not really. Okay. So then we'll go into the other side, and this is gallbladder.
Tender.
Okay, turn your head. Okay, so she almost gets to 90 degrees there. Now, it's never a guarantee, but you always want to say, what's the differential diagnosis? And when you study Chinese medicine and East Indian medicine like we do, and couple that with chiropractic and Western concepts, you can trace the pain in the body. Now, there's no guarantee it's going to be your gallbladder, but because the gallbladder meridian runs right from here, gallbladder 21, up the neck, and then does a ram's horn, basically covering this part, you can explain a lot of people's pain by one meridian. But then you have to say, as the emoji on the description says, is that where the issue is actually at, right? So we know that just by stimulating that reflex point on her body, she can increase her range of motion almost back to normal compared to the other side. So one might make a connection that that point down there might be connected to their neck up here. No guarantees, but it's always a good chance. Then you want to say, okay, well, the gallbladder's downstream from the liver, and what's the liver doing? Is it blood? Is it too many toxins coming in? Toxins can't get out. Is she cycling as a female? Are hormones from menstruation going on? All these different things play into the factor, and that's why we are drilling people with questions, because it's important to understand. Because when you ask the right questions, you get the right answers, and you get to the answer. And basically, if you ask the person the right question, they'll tell you the answer when you've done it enough times. Okay? So fantastic. So what we can do, and you've seen me work up someone's neck before, I believe Amelia, and we were doing PEMF before, and we might even work you before, but anyway, neck is a big problem, right? It's a big challenge for people, especially it's annoying, right? Because when Nis is working all day hard and helping our participants, and she's, and she's straining her neck just to try and engage. And I feel bad because she's sitting here, keeps turning and looking at me, and I should just sit like this, okay? But we'll just turn her head this way, and we'll just test. You just hold your head there, good, nice and strong. We'll turn to the middle, push your chin down, and then hold there, good. And we'll turn this way, and you'll hold your head there. And what you notice is she starts straining, and that probably hurt a little bit. I don't know what kind of grimace she made and the funny faces. We can also ask about the scalenes. Any tenderness in here?
Not as much.
Not as much, okay. Has it affected the shoulder at all? Have you had any weakness?
No, it'll just like when I move.
Here. It strains it more.
Yeah.
Okay. So just bring your elbow out here and just hold your arm in this position. Don't let me push. Okay. And then push up and back. Okay. Now that's the posterior deltoid. Okay. So she's not doing that very well. Now push up at a 45. But the anterior deltoid just works just fine. And the middle deltoid, you push straight up here. That works fine. We can also check the rhomboids and the muscles in the back. Just push your arm back toward me. And she's got nothing. Okay. But interestingly enough, we'll just, for giggles, is that the tender spot? Yeah. There it is. Okay. So now push your arm back toward me, and now she's back to solid. I'm sorry, tip this down, push up and back. Okay, so, not like you can just walk around and rub that spot all day long, but when you're in a pinch, I'll be like, okay, Nessa, just, if you get like really bound up and it's really locked up, just rub that spot for a little bit. You can relax that. Okay, so when you think about the gallbladder, especially since Halloween is upon us, a lot of fats and sugar will definitely mess up the gallbladder. Anything that might be like really crappy coffee, really bad teas and stuff like that. A lot of things come in with garbage stimulants and stuff like that, and that can all affect the liver. And the bile from the liver ends up in the gallbladder. So if you got an issue in the tissue of the liver, it can show up in the gallbladder. And if you could have a neuroemotional stress, that can show up in the gallbladder as well. So you need to understand that, here we go, no one thing causes any one thing, right? It's not purely structural or muscular. It's not purely biochemical. And it's not purely neuroemotional. So that's the triad of health. I'll try to make a triangle here. You got the mental emotional here, structural here, and you got the biochemical here. And that's why we look at all three prongs of that triangle, because that's how you get the best results. So when people come in here, I'm going to work on their neck, but only after I've made sure that have they been injured here? Like let's say she was doing jiu-jitsu in the dojo, and she got her neck, maybe she got an arm bar, and then she got tweaked in the back, and who knows what's going on, right? They do crazy stuff over there. What can happen is then I can tweak her neck, but that didn't happen to her. So once I've determined it's not a structural issue, I want to dig down further and say, what's her predominant issue, right? Is it neuroemotional? Is it biochemical? And in this case, it's not structural. So we dig a little deeper, start having conversations, figure out what the stressors are. When she becomes aware of the stress, some people think that I spend too much time on the neuroemotional component, but if you can understand what the conflict is, you can address it, and then the symptoms will go away faster. Because if you don't address it, it'll linger. Okay, that's the big difference. So when we're empowered to understand the conflict, we can say, aha, okay, what can I do about it? I can take back control of how I feel about it because I know what it is, where it is, what happened, who it's involved in with. And then when I enter that situation or the context of that person or that people, whoever it might be, I can be empowered to say, this is how I'm going to approach that. Okay, so it's really important to have that tidbit of information. Even if you don't understand it fully, I'm still going to drip it on you. I'm going to plant the seed like a farmer and let it grow and help you understand it. Because your subconscious brain understands it and it knows what's going on. And then she can then develop her own hypothesis and or beliefs about what it is and then go about changing it as she sees fit. She may decide, I don't want to do anything about it. That's fine. The symptoms will linger, but when she decides to say, okay, this is how I'm going to handle that, because I'm going to feel empowered to decide how I feel about things. I'm not going to let somebody else determine how I feel. They may do something, but I choose to feel a certain way, is how I often phrase things. When this happens, I feel. If you express yourself to somebody so they don't feel attacked, you can say, when this happens, I feel, which is really helpful to help them feel disarmed rather than saying, you make me feel, right? That's not helpful. Trust me. I've made that mistake a time or two before. At any rate, owning your feelings and talking about the behavior or the incident or whatever it might have been is really helpful. So for her, she might say, when this happens, I feel frustrated, angry, resentful, disappointed. I'm having trouble understanding. I feel like there may be some inflexibility, some stubbornness there. I'm feeling, when I hear that, I feel criticized. So all these things are relevant to gallbladder and neck and things like that, so kind of give you an idea about that. There are other things we talk about, the cervical spine and muscles being stuck and restricted. And the layers are there. We just don't know exactly, and we're not going to go through the laborious process of digging down to see what's affecting her, but just so you understand how this works and how you can be empowered to understand your body in the future. Hopefully that makes sense. Let's see. What other aspects of this has been bothering you?
Like laying down, like...
Ah, yes, the cradle in the head.
Yes.
Like you got to pick your head up because it feels like it's going to fall off.
Yep.
That's a good time. So what we can see is, are the muscles too tight on the back or are they too tight on the front? Okay, so just tip your chin down again and hold there and don't let me push. Good, and don't let me push again. Okay, so what happens is when she goes to activate the muscle, it actually becomes weak because it's over tight. And if we tip her head back and have you hold there, she can't even hold that. She's just like, push. Yeah, I don't have to put much pressure on that. It's just not working, okay? So she has an imbalance. She's got upper cross syndrome, what we learned in school. Basically, the muscles on the front are pulling her down, and they're weakening the ones in back, which is the equivalent of smoking now, because when your head comes like this, it's cutting off all the blood flow to your neck. So all of us who work at desks and things like that, fortunately for us, we have workstations that are up higher, But for all of those of you who have monitors on your desk, if you're going down, and don't think just because it's down there and you're like, oh, I'm paying attention to my posture. Gravity will take hold, and your intent to focus on something will eventually bring you down. Okay? So your monitor should be up about 5 degrees below eye level, just so you know, for ergonomic standpoint. We're working on, when we remodel, most of you don't know that, but we're about to blow up the wall here. Yeah, news to come. We're going to have standing workstations for our team so that they can stand up, be upright, maintain good posture, because that's one of the hallmarks of great health. Stand taller, live longer is kind of how the old adage goes. But if we can help her bring her body up, right, like this, and then chin back, okay? And this is probably painful for her, but keeping the ear over the shoulder. So if you turn this way, okay? So what we want to do is, this is the posture. There, it seems awkward, but her head needs to come back even further because you want the ear over the shoulder, right? Now it's too painful for her. I'm not going to force her neck because she's just like fighting me. She's like, oh, don't do that. But what can happen is, when your head comes 1 inch forward, it takes, let's just say she's got a huge brain on her, so we're going to say she's got a 15-pound head. If you move your head 1 inch forward, it's going to turn into 30 pounds. Now that may not seem like a lot, but when you add gravity to that, guess what? It's like a bowling ball on the edge of a cliff, just getting yanked down all day long. Does that make sense? So what we need to do is lengthen these muscles on the front and then strengthen the ones on the back, okay? So do you want me to do that, or do you want me to?
You can do it.
All right,
Yeah.
Okay. So this is a little different. I'm going to take your glasses off.
Yeah.
Okay, let's see if I can not pull your hair out. Okay, so basically, what I'll do is I'll put my knee here because then you don't fall. Hold on a second. There we go. So you don't fall backward. Okay, so you're going to tip your head back, lean back, and look up at the ceiling. Is that painful?
Yeah.
Okay. All right. So, yeah, there you go. So what's crazy about, you'll hold your neck and you'll move it around like, oh, okay, it gives me the support I need. The problem is, as soon as you take your head off, you're like, oh, my neck. So you have to be very, very mindful about that. So I'll just stabilize her neck. Do you feel it up here or down here? Like if you lean back now? Okay, hold on. Like that? No, you do it. Use your hand. There you go. Okay. So lean back. So she's got what's called a hyperlordosis in her neck, the forward curve. Okay, so I need to take stress off of her SCMs, okay? So I'm going to press out. You never want to squeeze in on the neck. It's not a good idea. It doesn't feel good. So what I want you to do is take a breath in, exhale and push forward. And now relax. Okay? You okay? Okay. Always ask the participant if they're okay. Deep breath in, exhale and push. And then relax. Okay? How you doing? Okay. Deep breath in, exhale and relax. Okay, good. Now, gently come forward. Okay. So, not the most fun in the world for her, but now if you think about this, I'm just going to help guide you back. Okay? And there's still some pain there, okay? So what we need to do now is look up at the ceiling. Tender there. Okay, take a breath in. Exhale and bend down. Okay, so now we're balancing it out, okay? Deep breath in. Exhale. Okay. And one more time. Exhale. Okay. All right. We're having a good time now. It's a joke,
Sure,
right?
Joke.
I got funny jokes. No, I don't. Hold your chin down and don't let me push. Good. And then hold down again. Good. Now we've restored proper function. Now that she activates her neck, it's not going to shut down on her. Now if she tips her head back and push back, now it's strong. Okay, that's helpful. Having a neck that works is helpful. Now you can face that direction. There you go. Now just tip your head to the side, and we'll test how much pain does that cause you.
Not that.
Okay, hold your head there, and hold again. So she's doing pretty good this side. But you can still see, I don't know if you notice how easily she goes this side, and she actually rounds her head over. If she goes this way, it's kind of like a straight bar, okay? So tip your head this way and push down. Okay, and again. Okay, so then let's just go this way. Yeah, she still doesn't like that. So hold there, and that's activated. Okay, turn this way, and hold there, and hold. Okay, so the right side of the neck is just fine, okay? So you're feeling it back here, yes? Okay. So turn this way, take a deep breath, turn to the right. This is not going to tickle, okay? She may be making funny faces. Deep breath in. She's got some inflamed lymph nodes. Okay. Good. We having fun yet? I'm joking. I don't try to be funny, but I just try to kind of get them to ease their tension, okay? So the cool thing about this is, of course, these ladies joke about my one-liners all the time, but 18 seconds of discomfort's better than walking around with your neck that doesn't work, right?
Yes.
Okay, turn this way. Okay, now she's back to at least, I'd say, 75 degrees. Now hold your head there. Don't let me turn it. Okay, now she can actually hold again. That's very helpful. Then now she turns over her left shoulder to see if there's a car coming. A, she can look, and B, she's not going to go, oh God, and drive into the ditch. Okay, it's helpful. So by no means do I have any expectation that that's going to be perfect or ideal for her. It's going to be better. She'll have better function. She'll have less pain, even though she endured a little bit of discomfort. What we do now is what we're working on is alleviating the tension in the gallbladder and liver area so that her body can then allow proper energy flow, because everything in your body is energy flow, right? Down and out, up and out, whatever it is for your body. That's really the way you want to look at it, okay? So hopefully this has been beneficial. Hopefully that she's benefited from it as well. Let us know if you have any questions on this, and maybe you have questions about your neck and, I swear it's my pillow, and whatever you might want to say. I can almost assure you that unless you got some really funky pillow, it's not your pillow. In fact, if you wonder, just take your pillow away. There are plenty of millennia that we slept without pillows. I wish I have to look back and see what the advent of the pillow was. But at any rate, next week we'll be coming to you live from Pereira, Colombia.
Okay.
Maybe. We'll see. We'll see if we can pull that off. We're traveling to Pereira, Colombia to our sister clinic to do some stem cell work. We have some participants going with us. I'm going down, so I'll be receiving 150 million stem cells in my body. I'll probably be glowing when I come back, so if I look green, just know I'm like supercharged. We'll see what happens. But other than that, any other announcements you want to add? Okay.
Nope.
Any insights that you want to share about anything?
I think we're good.
Okay, fine. Sweet. So we'll look forward to catching up with you next week. Safe to say that if we're able to pull off finding Wi-Fi and stuff like that, and we can pull off the Wednesday Wellness Minutes, it'll probably be about stem cell and regenerative cellular therapy. Okay? So look forward to that. Tune in next week, and we'll look forward to seeing you next guys. Say bye.
Bye.
See ya.